Welcome to Keep Alive. I'm your host, William Lee, podcaster, podcast producer, and the founder of the Kiva Agency for Digital Marketing. Today I want to talk about the dilemma at Good Sam Hospital in Puyallup. We'll be right back. Well, what do you think happened at Good Sam Hospital? Everybody's kind of in a real uproar concerning the nurse that was working in the emergency room who unfortunately had hepatitis C and was passing it as a carrier. 2,600 people came into contact with a possible carrier who may now be looking at having that disease. Yeah, I don't know how you look at it, folks, but I'm telling you that I would be very nervous if I was one of those 2,600. Multicare's COO yesterday announced that they are definitely investigating this complete problem of how this could have happened with their high standards and excellence in service. Well, obviously it did happen, and 2,600 people are affected one way or another. Maybe not with hepatitis C, and we certainly hope not, but also they are affected with the mental anguish of not knowing. And why didn't the hospital contact us earlier? What's going on at the hospital, and what else may they be covering up? Now, I'm not going to come out and say that the hospital itself is at the complete fault of what happened, and I'm not going to point fingers at anybody. In fact, I have a lot of admiration for the doctors and the medical technicians and nurses that work at Good Sam Hospital or any hospital in this area. I have a lot of respect for them. The problem seems to be that maybe just a chance out of the wild blue sky, that Multicare has grown to be such a monster in the industry that they have set themselves up for being targets. Targets in what direction? Well, I think it's a target in the actual understanding of how their operations work. You know, Multicare really has been a monstrously large corporation, eating up hospitals one after another, purchasing different clinics and changing the medical community considerably. We now know after about 1980s when it was brought to our attention that corporations could run hospitals far better than individual organizations could, and that we could save money and get better house or hospital care by going through and, shall we say, turning our medical industry over to corporations. Corporations like Multicare, who runs billions of dollars, I'm sure, a year through their tills, oftentimes, shall we say, overlook or fall behind the eight ball when it comes to actually presenting and maintaining the policies in which we're talking about, especially at Good Sam. Now, the question I have is first of all, how long has this really gone on? Multicare has got a terrible forest fire burning, and the CEO yesterday ripped out a fire hose and tried to put the fire out, or at least calm it down until the flames and smoldering ashes could be collected and the full story could be brought out to the general public. But how long has this been going on? Now, they said it was from 2017 until March of this year. Now, in my book, that's quite a period of time to have something of this magnitude happen at one of their premier facilities. I often wonder if corporations are more, shall we say, interested in the bottom dollar, the ka-ching for their investors. I often think to myself, wow, when I read reports from Forbes magazines or different publications concerning business about CEOs that make millions of dollars a year running these large corporations, you would think that with that type of money flow that there would be a lot of very in-depth high technology incorporated in making sure that the well-being and safety of their patient loads through these hospitals was one step above phenomenal. Now, the COO yesterday made a very interesting statement when he said, and I quote, well, there's 2,600 people that could be affected, but let's look at the average odds of what's going on. Out of that 2,600 people, there's a very good chance that only 10% maybe have been affected by the disease. So here we go. 2,600 minus or plus at a 10% ratio would balance out to 260 possible cases of a horrifying disease that was given to them at a medical facility that is governed by high quality and excellence in service. Now, I know it's impossible for any hospital anywhere in the world to be able to control and make sure that in everyday activity that these problems don't occur. And I want to make it very clear that I'm not going to sit here and point a finger at anybody. But what I am going to do is try to get a conversation started that I hope will go over the platforms of the different social medias to get people to be aware of the factors that this is a possibility in the society that we're living in today. That the dollar bill in some cases has overflowed into the reality of quality, of honesty, of clarity, just to keep our investors happy. And I'm not saying the Multicare is a terrible organization. I'm just saying that this is a case that we should be looking at with a fine-tooth comb. Now, let's go back a little bit and listen to basically our own thoughts of, first of all, how could this have happened? How could an employee, a medical person who should have been screened out for different diseases, her medical records or his checked out before they went to work for the hospital, how did they slide through this screen of employment? How did this happen? Did the HR department forget to send out a folder of information to this particular prospect to go to work? Or did we just too busy? I have too much to do. Too many things on my desk. Could it have slipped through in that procedure? I don't know. And I'm not here to say if it did or not, nor am I to mark the terrible factor that HR has got mud all over their face now also. Here's what I really want to get to the point of. 2,600 people have been affected. Okay? This nurse, in this particular case, and remember, is innocent beyond the shadow of a doubt until proven guilty. We can't really point the whole finger towards her brutally like I would like to do. But the point is, how did she get to this position? And then when the CEO mentioned in the interview on television that, oh yes, we discovered that this nurse had been stealing drugs and records had been changed or altered, that she was fired from Multicare for stealing. Why didn't that go any further? And of course, the answer is very simple. We don't want that type of information out to the public. That should definitely stay in-house because, of course, we've got the public that would be upset, but wow, the investors might be a little upset also to find out that their bottom dollar may be rocked with scandal. This whole thing is ridiculous. I want you to think about this. 2,600 lives have been affected. Okay? Not just in the sense that they may have the disease, but in the mental sense that they didn't know that this is a possibility. Now, here's another interesting point that was brought to my attention. I had a phone conversation with a gentleman who had just checked out of the hospital 2 weeks ago. Isn't it interesting that before this story hit the press, that when he looked through his records, he found out that he had also been tested for STDs, for other diseases, and hepatitis. Wonder why we would do something when he went in with a breathing or respiratory problem. Very interesting, isn't it? Oh, by the way, he did receive a letter from Good Sam saying everything tested out just fine and not to worry about it. Now, I've also talked to some people who have been in the hospital during this time period. Of course, they haven't received their letter as of yet and was terrified when they all of a sudden looked on the internet and there it was, 2,600 lives affected by a incompetent operation. Incompetent? Yes, because I find it's incompetent that they would allow this particular person to continue on working because this nurse was hired to begin with and was not screened properly. The hospital knowingly or not knowingly put this danger into their system. It's not a great idea, isn't it? Well, now let's go back and look at Multicare. Of course, the first thing that we have to do is acknowledge that there's a problem, which they have done on the media channels. Next, we have to find a fall goat or somebody that we can execute to cover up for our, shall we say, misjudgments, which they have done by saying a nurse caused this problem. Of course, the nurse did. And it's not that they found it. It's because the CDC and other federal medical agencies stepped in when 2 cases of this problem arose and discovered through science that these 2 patients were treated at Good Sam by the same nurse, who, by the way, has tested positive. Now, wow, what do you do in a case like that? Well, of course, I'll tell you what you do. If you're multi-care, you get your staff of attorneys and you run to the boardroom. You get the CFO, the CEO, and all the other people that have alphabets under their name or belt who are being paid big bucks to gather around the campfire. I guess that's the greatest way I could visualize it, and discuss on how we're going to stop this horrible, horrible media mess before it gets started. Now, like I mentioned before, we have to have an scapegoat. That's number 1. Number 2, we have to rally around those who have discovered and pulled the alarm that we have a problem. We have to make them look like heroes, of course, and that we are, without a shadow of a doubt, going to plant our feet in the concrete and make sure that with their help we can straighten out this problem. Well, wonderful idea. I can tell you right now that that's probably great for running a campaign for a president. But it doesn't seem to be fitting for those who are wondering, why wasn't this brought out to our attentions to begin with? Of course we're going to be upset. The community is going to be upset. But we're going to be more upset when we figure that we're being pushed around and, shall we say, left in the dark. How is this going to also affect the people that are in Good Sam right now getting care and treatment? Well, I sincerely hope that it does not start an epidemic of allegations and people starting a massive witch hunt, which we really don't need at this time. I'm really concerned, however, also, can Good Sam bounce back from this immediately? I've heard people right now telling me that, if I get sick and if my husband drops me off at Good Sam Hospital, when I get out, if I get out, I will divorce him because he was cruel to me. That's pretty ugly allegations, isn't it? Especially towards the good people that work at Good Sam, and there's a lot of them. I really respect them, and I feel bad for the employees that'll have to carry this load around on their back. But it isn't the medical society that should be carrying the load. It's Multicare's management that should be carrying the load. It's Multicare's dollar system that should be carrying the load. Now they're going to have to naturally pay for all medical expenses because we know that the CDC knows what's going on and will be watching them. We know that the health department will be sitting patiently waiting to find out if these moves of cleaning up their policies and acts and making sure that people are not being treated by individuals that have diseases is not taken care of. It has to be taken care of. And they will be living with Good Sam Hospital, I'm sure. Now, what can we do as community citizens? There again, I'm going to go right back to what I believe the Keep Alive podcasting is all about. It's about having a conversation. It's about sitting down and talking about what we can do and the actions that we can take to make sure that these types of things don't happen again. Now, Multicare is a big organization. They've got, I'm sure, as Mr. Facebook had, several attorneys at $1,250 an hour or more that are making sure that they do not answer questions and come up with speeches that are very, very well written. We wouldn't want anything to, shall we say, upset the public view. On the other hand, we don't want anything that could, shall we say, spark lawsuits or investigations. Oh, those would be very, very hard on the corporation pocketbook. But here's one fact. There are a lot of people out there that were involved in this situation that Multicare owes an explanation to. There are good people that had the confidence to go to Good Sam Hospital for treatment when they were ill, not to become iller. Multicare has the responsibility of cleaning this mess up, and it's not by throwing somebody under the bus. And it's not by trying to push the blame off or use fancy attorneys to put this information away. They have the responsibility